Welcome everyone. Hopefully we're live, if anyone is watching. I'm Councillor Matthew Willington, Cabinet Member for Health, Wellbeing and Social Care. Just the usual about the fire alarm. I think everyone here knows the score. Just assembled by Queen Victoria's statue in Guildhall Square. Members of the press and public, and we have Josh from the press here today, are permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly they do not wish to be recorded. Please can everyone use their microphones and remember to switch them off when they're finished. So, just go around the table. Anna?
Anna Martin, Democratic Services.
Richard Webb, Finance Manager for Adult Social Care and Public Health.
Andy Biddle, Director of Adult Social Care.
Yinka Adelero, Councillor for Charles Dickens Ward.
Thank you very much. As I say, Josh is here from the news. We have no deputation request today. Apologies for absence.
Councillors Brian Madgwick and Lewis Gosling.
Thank you very much. And we also have apologies from Joe York, who's the Managing Director for Health and Care Portsmouth. Yinka, any declarations of interest?
No, thank you.
Thank you very much. I have no declarations of interest to make either. So move on to item 3, prevention and reduction of need, independence and wellbeing team. Over to you, Andy.
Thank you. So the paper that's before you, the sections 1 and 2 set out the purpose of bringing the paper. Section 3 sets out the legislative background to the work undertaken to promote independence and wellbeing and prevent, reduce and delay need as part of the statutory duties under the Care Act. The Section 3 also details the links that this work has to the Adult Social Care Strategy and how the independence and wellbeing team works to achieve those objectives on behalf of the service and with the people of Portsmouth. Section 4 sets out the main areas of the work of the Independence and Wellbeing Service and the impact of the COVID pandemic on curtailing some of that work and the methods that we use to gather data. This section then goes on to set out the examples of the work completed by the team in a bit more detail. Section 5 of the paper describes how the service is planning to develop new opportunities in the 23-24 year, and then Section 6 summarises the paper and the role of the team. Bringing this paper to you, it's part of our statutory duties under the Care Act to prevent, reduce and delay need. It's also something that we're very conscious of in terms of supporting our citizens so that we're not looking at necessarily looking at purchase services as a first option, but looking at what networks and support exist within local communities and hooking into that where we can. It's part of our strategy, it's a central plank of our strategy, and it's something that we're going to be doing more work on as a service in the coming financial year. As always, happy to take any questions on the paper. Thank you.
Thanks very much, Andy. Yinka, did you have any comments or questions?
Thank you, Andy. This is a good report because I know we've been through this before during our meeting, so nothing from me. Thank you.
Thanks very much, Yinka. Yeah, I'd just like to thank Andy and his team for the reports, and specifically Sharon, who is the service manager for independence and wellbeing. It is a really important service in terms of it's about the holistic support that we give to people in our city who are in need, and working together with the different parts of the organisation that are mentioned on there. I know from my previous job in particular, when I was supporting people, how important things like community connectors are, and that getting back into its swing post-pandemic has been really good. And I know there's the further working together with the wellbeing team within public health as well is something that we're moving towards as well on this. Together with obviously reinitialising things like Chat Over Chai, which is obviously an in-person group, but also making sure that we're engaging with our volunteers, and we know how good that can be, both in terms of giving people, being a stimulating thing for our volunteers, but also for helping with people re-engage with the workplace as well. So that's a really good point there. And I just think the most general thing is this is about people's well-being, much more holistic than just about their health as well. So thanks for the report, Andy. Really happy to note this and look forward to our next update when it's due. So on to item 4, Carers Survey and Strategy. Back to you, Andy.
Thank you. So section 2 of the paper sets out the purpose of updating members around the Carers Survey and the strategic plan for carers that we've been working on in the city. Section 3 sets out the context to carer support in Portsmouth, highlights some of the national data around numbers and type of care being provided in the UK by unpaid carers. And section 3 also details the legislative and policy context to support for carers. It's notable that since the Care Act in 2014 gave parity to people that were caring as well as those that were cared for in law, we've seen the changes is set out there in the legislation last year, the Health and Care Act of 2022, which gives further rights and acknowledges informal carers as experts in their situation and the person that they're supporting. And importantly talks about consulting unpaid carers, informal carers on discharge from hospital, which is something that carers have been asking for a long time. It's worth noting that, and it's noted further on in the report, that there's also a bill going through Parliament at the moment to give carers the right to ask for unpaid leave from their workplaces if they're in employment. So what we're seeing, I think, is a general build-up of rights for unpaid carers and acknowledging the immense amount of support they offer in our society. Section 4 describes the background around the carers survey that's conducted and returned to the Department of Health and Social Care and those statutory returns of data that we make each year. And section 4 also provides a summary of some of the data in the survey. In the main, we're seeing better than average performance in Portsmouth. We're seeing better than the average England results and performance around carers. Doesn't mean we should be resting on our laurels, but is reassuring to see with a slight drop in some areas. Section 5 describes the history to the strategic plan, the impact that COVID had on getting that carers plan together, and the process that we're following for revising the carers plan for the city. It's worth noting we had a very successful and well-attended event in November of last calendar year where we launched the short plan that we'd come to in consultation with carers in the city. We had a lot of agencies there at that event, plus a lot of carers themselves, and it was a really successful and engaging day. And we will be bringing forward the full strategic plan, hopefully this fairly soon, this calendar year. Section 6 outlines the priorities that we came to in that plan. It's worth noting that the plan is written to be accessible. It's written to be in accessible language. And that was another key objective in working with our residents to make sure that everyone could access it, could understand it. Section 7 then identifies the links to other areas within the council, and Section 8 the likely publication date of the full plan. Bringing this report here for noting is quite timely. We've seen the Housing and Adult Social Care Scrutiny Committee in this municipal year make an inquiry into respite care that's available for unpaid carers and cared for people in the city. We've got, as I said, that bill going through Parliament that the Cabinet wrote in support of in terms of carers being able to request unpaid leave, and that's been supported across the House, is my understanding, and by Carers UK. We've also seen in recent months the publication of the 2021 census figures, which includes updates on unpaid carers nationally in the country. And we've had further discussion, although no movement yet, on thinking about unpaid carers being a protected characteristic in the same way that there are other protected characteristics under the Equalities Act. As I say, there's no movement on that at the moment, but it's a growing discussion. And I think it would be helpful for us to bring back any updates that we hear around that, any sponsorship around making unpaid care a protected characteristic. That's the paper as before you, but as always, happy to answer any questions or queries. Thank you.
Thanks, Andy. Yinka, any comments or questions on this one?
Again, I would say thank you, Andy, for the report. But I know, number 6, the priorities. I'm so glad you have the carer plan priorities on ground. So do you have any plan to execute this, all these things that you have identified, as planned for the carers, the priority? Do you have any way, what are you doing to execute this something? Thank you.
So the intention is once we bring forward the full plan and we've got the publication date in the report, then we'll have regular reports back on how it's been implemented. We'll have actions. What we don't want is to see a plan that sits on a shelf or a plan that is just fine words. So we're accountable as a carers service to the carers groups that we work with in the city, and we'll be aiming to hold another event, another carers engagement event, once the plan's been published, to update on those actions, what's been achieved. We'll also probably bring back the report. We need to publish a response to the Housing and Adult Social Care Scrutiny report that will be published in March, and it would be right to bring our response as adult social care back to carers in the city as well, to demonstrate what we've done in response to that. So the intention is to show the actions that have been taken to achieve those items in the plan. Does that answer your question?
Anything else, Yinka?
No, thank you.
Okay, great. Thanks again for this report. This is a really important report, as our carers are an absolute backbone to our city and the work that they do. I went along to the Carers Count events in November that Andy mentioned, both with my this hat on and also my work hat on, and it was so good for it to be so full. It was absolutely packed, and the discussions and contributions that were going on there were absolutely excellent. And the fact that we've got such strong priorities that have come out of that, the 5 strong priorities, I think is a real commitment to that work from that event. And as Andy said about the oversight of it, of course we have the Carers Oversight Group, which is going to implement that. I think it's worth also placing on mine and all of us at the councils, all members, thanks for the work of the Carer Service. It's been mentioned before, I think we were talking when we had our briefing for this meeting about the fact that we are unusual, the fact we have a carers service that is run by the council directly, and they do a magnificent job, and they work so well as well with other agencies, both statutory, non-statutory and voluntary community sector, and more widely obviously with the carers themselves. I think just digging out of the report myself, I'd like to draw out about the fact that Andy chairs our South East Association, Director of Adult Social Services Carers Network, and that Claire, who authored the report, so great thanks to her, has been working extremely hard on the carer side and formerly was manager of the Carer Centre, she supports that as well, and she represents that group at the National Carers Policy Network. So we are very closely linked into carers in this city, and I think we are seen as an exemplar. Certainly with my day job hat on, work with a lot of carers for people with dementia, and some of those are outside the city, and there is a real difference between the provision that we have in Portsmouth compared to what you have just over our border, which I think does make a real contrast and really does show that we do a good job. And the interaction with the carer centre and with our carers generally, as has come out from the survey, has a above average compared to the rest of the country in terms of the response. But we can't rest on our laurels, and it's really important that we carry on supporting our carers, make sure that all carers know that the support is out there, because that's one of the things that does come out, that though we do promote our carer service in the carer centre, that still not everyone knows about it, and it's trying to make sure that, and that's part of the strategy, is making sure that people get involved and they know that resource is there for them, because there's nothing worse than being an unpaid carer and thinking you're on your own. But also, as we often know, I think we all know within this room, talking to carers who don't think they're carers, they just think they're doing what everyone does, doing what a husband does, a wife does, partner does, a loved one does, a parent does, but actually in many cases they are caring for someone over and above what would be imagined. So that's something that we should always work on, but I'll just put on record my sincere thanks to all carers in this city. They, as I said earlier, they are the backbone, and if it wasn't for them, we would be in a much worse state. So thanks so much for the reports. Thanks so much for all the work that goes on with carers, and thanks again to all the carers in the city. That concludes the meeting. Thank you very much, everyone.